If you are on heart medication, or you've had a stent, or you've been told your numbers are not controlled, well, then this video is for you. After treating more than 10,000 patients, I have learned that managing heart disease and improving heart health are not the same thing. I show you what your prescription is doing, what it isn't doing, and what you should be focusing on instead. The prescription is buying you time, it is not solving the problem. Most people who take long term heart medication believe that one or two things: either the tablet is fixing the problem, or they are so broken that the prescription will make things as good as possible. Nobody has been told the third option. The statin lowers your cholesterol. It does not remove the stress, the poor sleep, the burnout that raise your cholesterol in the first place, and the diet for that matter. Think about what that means. The tablet holds the door open. What you do while that door is open determines whether you ever stop needing the tablet. I have, in fact, watched patients reduce their medication. Some have come off it entirely, not because I told them to, because they went to work on the root cause and their body stopped needing the same dose. I've also watched other patients take the same tablets for 20 years while the root cause kept running underneath. Same prescription, very different outcomes. The tablet is part of the answer. The part that matters most is what most patients are never shown. Number two, a normal scan after a cardiac event does not mean that you are fixed. So a normal stress test, a normal calcium score. Your arteries can actually look completely clear on a scan 12 months before a heart attack happens. The scan shows the state of your arteries at this moment. It does not measure what is driving them toward the next event. Your stress does not appear on a scan. Your sleep does not appear on a scan. The cortisol running through your blood, through your heart, and through your brain at 2 o'clock in the morning when your brain will not switch off, none of that appears on a scan. What the scan cannot see is the life you go home to. In my experience, most patients go home to the same life that created the problem in the first place. The same pressure, same sleep, same diet, same everything, except now they have a clear scan to suggest that they are fine. That is the most dangerous moment in cardiology, not the diagnosis, the all clear. A clear scan is good news. It is not a finish line, and treating it like one is how people end up back in my waiting room wondering what went wrong. If this is landing for you, subscribe. Every week I share what 20 years of cardiology and lifestyle medicine has actually taught me about keeping your heart healthy for the long term. The link is below. Point three. Here is how you know whether this applies to you. You are on medication. Maybe you've had a procedure. You have been told your numbers are being managed. And deep down, you know that managed is not the same as better. So here are three questions. Are you on long-term health medication and have never had a conversation with your cardiologist about your stress, your sleep, or what your daily life actually looks like? Have you had a stent, a scare, or a worrying result and walked out with a prescription but no real sense of what caused it? Do you feel like your heart health is being managed medically, but something important is still not being addressed? Most people who answer yes to two or three of those questions do not think of themselves as having a gap in their care. They think of themselves as compliant patients. Doing everything you were told is not the same as doing anything that matters. Nobody gave you the second list. Point four. The change required is much smaller than you actually think. Most people hear lifestyle change and picture a complete overhaul: new diets, daily exercise, meditation, alcohol gone, stress somehow eliminated. They picture the version of themselves that does all of it perfectly, and they already know that person's not coming. So they do nothing. I've spent years studying behavior change, not as a hobby, because I kept watching patients accept the diagnosis, accept the prescription, and then freeze completely when it came to doing anything else. And I needed to understand why. The answer is almost always the same. The goal they set was too big. They aimed for the whole staircase and never took the first step. Here's what the research actually shows: small, consistent changes to your sleep, stress, diet, exercise, social connection move your cardiac risk in a measurable direction. Not massive changes, small changes repeatedly done, not perfect. As an example, take 2 extra pieces of fruit a day to reduce inflammation. 10 minutes of a genuine rest before bed changes your cortisol levels by early morning. A short 15-minute walk 4 times a week has a measurable impact on your blood pressure, particularly after a meal. And none of these feels like enough. That feeling is wrong. The patients I have seen make the most progress are rarely the ones who overhauled everything at once. They are the ones who picked one small thing, made it easy to do, and did not stop. They enjoyed doing what they were doing. They changed those behaviors into a new habit. You don't need to become a different person. You need to do one thing differently, then another, and your heart will respond to that faster, even so, than most people think. Point 5. What to do when you realize the prescription is not the plan. Think about a tap running into a bath. The medication's a great drain. It keeps the bath from overflowing, but the tap is still running. Lifestyle change is the hand that turns down the tap. You can rely entirely on the drain, a lot of people do, or you can work on both. When you work on both, the bath stays at a much safer level. The 6 months between your cardiology appointments is where your real heart health is either improving or getting worse. Most people are told to take the tablet and come back in 6 months, sometimes in a year. Nobody tells them what to do within that time frame. Patients who address the root cause feel the difference before the next scan. Sleep improves, energy changes, the low-level fear that sits underneath every day after a cardiac scare begins to lift. Because for the first time, they are working on the thing that caused their heart problem. So before your next cardiac appointment, here are 4 questions to bring with you. What is driving my risk? Not just what is my risk level. Is there anything about my lifestyle that is working against what this medication is doing? What would need to change for me to need less of this medication over time? And what should I be doing between now and my next appointment that has nothing to do with tablets? If those questions get answered, you are in good hands. If they get deflected or rushed, you know now what conversation to go looking for. Most patients leave cardiology appointments understanding what their medication does, and very few of them leave understanding what it does not do. The gap is not your fault. Nobody explained it. The system was not built to explain it. The tablet is the safety net. The work underneath it is yours to do. And it is more possible than anyone has told you how to do it. If you want to understand the 5 signs that this process has already started in your body, that video is on the screen now below. Watch it before you go to sleep tonight.